At the time that I was diagnosed with thyroid cancer 7 years ago, I didn't know what palliative care was. No one ever mentioned it to me, so I didn't know to ask for it, and my survivorship path was harder than it needed to be. I now know that palliative care improves quality of life by treating the whole person. This team-based approach provides support to relieve pain, symptoms, and stress of serious illness. It is appropriate at any stage, and it helps the patient and the family. This was me before I was diagnosed with cancer. A new Master of Public Health degree, a great and very demanding job with a national research program. I traveled, worked out, did yoga, had a healthy diet. Life was good. And this is me after my diagnosis. The center of a hurricane, there was a ton of information to take in and important choices to make quickly. I went from an unexpected diagnosis to surgery in just 2 weeks, including getting a second opinion and finding a new surgeon. I had surgery at a world-class medical center, but after surgery, I was on my own. The only follow-up I received from that institution was periodic surveys asking about recurrence of disease and rehospitalization. Palliative care is so important because we don't know what we don't know. Honestly, I thought if something was supposed to be happening, someone would tell me. Each new patient should not have to try to figure it out. Better support means better care. My family. Among us, we have all these degrees and expertise in health, molecular biology, chemistry, and education, and we struggled. We talked a lot about that and wondered how other families with fewer resources managed. We coped through a combination of MacGyver freewheeling inventiveness and mama bear caretaking. I learned how tough I was, pushing through it to keep up with life. I could not have done it without the kindness and resourcefulness of my family, friends, and coworkers. When I left the hospital, I was given a bag of drugs and pushed out the door as a big blizzard approached. There were a lot of issues with medication, timing, and interaction. My sister developed a huge medication chart, and my kindergarten teacher mom gave me sticker incentives. I endured constant pain for 6 months. Communication was hard for me. I could only bear to speak for a few hours a day before my entire throat was on fire. Except for right after surgery, I had no pain management. I thought I just had to live with it. Fatigue was a huge problem that lasted for about 2 years. The only reason this wasn't a total crisis was because I had an understanding boss who let me work from home so I could rest as needed, and the type of job that was conducive to that. I was lucky. I struggled emotionally. I was in the doctor's office one day about a year after surgery. Filling out standard forms, I read this question and I started to cry. I realized I didn't know if I was healthy or not. My sense of self had been badly shaken. I had a lot of fear and anxiety. I tried unsuccessfully to find help, and in the end, I just lived with it. I see now that I had internalized messages I was hearing that thyroid cancer is easy or the good cancer, and I thought I just needed to be tougher. I lost confidence in my ability to exercise, and I had body image concerns about a very large and visible scar on my neck. For 2 years, I avoided the gym. One snowy day, 2 months after surgery, I set out for my first walk. I now have a strong desire to make sure that no one else has to go through what I went through. Even in the center of the storm, my public health systems thinking was churning away. I knew we could do better in Minnesota. How can we make the path easier? Objective 18 of the Cancer Plan describes several strategies. Think about how you and your organization can commit to action. Momentum is gathering. I'll give you just a few policy examples. ACS CAN and others have been working on federal legislation to improve training, research, and access to palliative care. This bill made great headway in 2016, and supporters are optimistic that with continued advocacy, it will become law during this Congress. As of last year, the 13 states shown here in green have created advisory committees for palliative care. This year, Minnesota is one of more than 20 additional states to pursue this legislation. The Minnesota Palliative Care Coalition supports this action. Bills to form a statewide palliative care advisory committee have been introduced in the Minnesota House and Senate, and there is strong bipartisan support. In fact, just now, I just got a text, the bill passed unanimously out of the Senate Aging and Long-Term Care Committee. Palliative care can make a huge difference in quality of life for people facing cancer. I hope you'll join me in the working session to connect with others and commit to action. Together, we can make the path easier.